all of you. Namaste. அனைவருக்கும் என் காலை வணக்கங்கள். Thank you for being here.
Thanks.
We have achieved something great in the last 1.5 decades in terms of robotic surgery. We are here to announce certain numbers here. இன்னைக்கு எதுக்காக உங்களை வர சொல்லிருக்கோம்னா, especially a special thanks to media for being here. Special thanks to all the doctors here, and very special thanks to our Vice Chairperson, Dr. Rita, for coming here. Thank you so much. I want to start with some genuine, proud message to announce to all of you. Apollo Chennai Region Hospitals, 5 hospitals with 11 robotic systems for 18 specialties with the 55 surgeons have completed 8,000 surgeries so far in the last 1.5 years. Again, this is not about numbers we wanted to announce today. We invited you to show, not only to speak about what we have done, we wanted to show how the robotic system is really helping in improving patient outcome. So we have 5 robotic systems displayed in this hall. Whenever you find time, I request the media team to go and have a look at and interact with our doctors and the team to see how this is functioning. Everything starts with a big vision. Our chairman, Dr. Pratap Reddy, 2 decades itself thought that the future of surgery is robotic system. ஒரு 2-3 decade முன்னாடி பார்த்தோம்னா surgery itself is there is an evolving in the last 20-30 years. ஒரு 25 வருஷத்துக்கு முன்னாடி இப்போ appendix ஆபரேஷன் பண்ணோம்னா அப்டமனை ஓபன் பண்ணி தான் ஆபரேஷன் பண்ணுவாங்க. அதே ஒரு 15-20 இயர்ஸ் முன்னாடி லாப்ராஸ்கோபிக் சிஸ்டம் இன்ட்ரோடியூஸ் பண்ணாங்க. இப்போ robotic system. In the last 3 decades, every 10 years, we are seeing an evolution in how the surgery is growing. Open surgery, laparoscopic surgery, robotic surgery. World level, there is one prediction. In 10 to 15 years time, most of the surgeries will be done under robotics. Robotics illama endha surgery me nadakadhe oru 10-15 years time there. Apollo Chennai region is not adapting robotic technology. I just wanted to say that we are actually leading the country in terms of providing surgical options through robotics. I think that's the biggest thing we are making. That's the kind of investment Apollo Hospital has done. It's not only the investment of technology, bringing in robots, that's not investment. Apollo Hospital has carefully devised its strategy 15-20 years ago under the leadership of Dr. Pratap Reddy and VC ma'am and all the promoters to develop this technology and then invested in bringing in talented people from multiple parts in the globe. We have so many surgeons sitting here, got trained, also training for the last 15 years to produce more and more surgeons so that this technology can be offered with safe. If robotics, எதுக்காக நம்ம robotics பண்ணுவோம் அப்படின்னு கேட்டிங்கன்னா, இப்போ any part of the body முன்னாடி பார்த்தீங்கன்னா ஒரு பர்டிகுலர் பார்ட் மட்டும் தான் ரோபோட்டிக்ஸ்னால பண்ண முடியும். இன்னைக்கு பார்த்தீங்கன்னா 18 ஸ்பெஷாலிட்டியில நெக்கில் இருந்து ஒரு தைராய்டு ப்ரொசீஜர் கூட இன்ஜெக்ஷனே இல்லாமல் நம்ம ரோபோட்டிக்ஸ்னால பண்ண முடியும். ஸ்பைன் சர்ஜரி ஆகட்டும், நீ ரீப்ளேஸ்மெண்ட் ஆகட்டும், ஹீப் ரீப்ளேஸ்மெண்ட் ஆகட்டும், எனி சர்ஜரி இந்த டம்மி இட் கேன் பி டன் robotically. என்ன அட்வான்டேஜ்? இன்ஜெக்ஷன் வந்து ரொம்ப ஸ்மால், ரெக்கவரி இஸ் வெரி குவிக், பிளட் லாஸும் ஆல்மோஸ்ட் நில். Tough. Even laparoscopy la some of the parts வந்து difficult to access. Robotic surgery நீங்க பார்க்கலாம் அந்த ஸ்கிரீன்லயே, the display is so clear, surgeons will be able to access with the robotic arm easily. One of the myth பார்த்தீங்கன்னா, அப்ப நம்ம சர்ஜரி தேவையில்லையா, robotics எல்லா ப்ரொசீஜரும் பண்ணிடுமா அப்படிங்கிறது ஒரு காமன் கொஸ்டின். அந்த கொஸ்டினை we are going to answer that question. Robotic system surgeons ரீப்ளேஸ் பண்ண போறது கிடையாது. At the same time it's like surgeons வந்து ஒரு சூப்பர் சர்ஜனா மாத்த போகுது. அதான் பண்ணிட்டு இருக்காங்க. ஆக்சுவலா சர்ஜன்ஸ் ஒரு டிஸ்டன்ஸ் பிளேஸ்ல இருந்து கூட இன்னைக்கு த்ரூ ரோபோட்டிக் சிஸ்டம் ஆபரேட் பண்ணலாம். எந்த பார்ட்ல இருந்து கூட they can operate. So we have a lot of things to do today. We have our vice chairperson here. She will be talking more about the Apollo's commitment in terms of producing more and more fantastic outcomes, clinical outcomes by robotic surgery. Thank you for all your contributions.
And Vanakkam. I'm just so excited to be here today with all of you. One is, I have to thank the members of the press and the media who've been with us on this journey for 43 years. And that's what Apollo has been. And I also have to say on the other hand that it's very rare to get a galaxy of clinicians who have really made a mark in the whole Apollo history and for people at large, for humanity at large. So can we give our clinicians a big hand? You know, I think while people talk about assets and people talk about companies and performance, our most valued assets are our staff and our people. And Chairman says it all the time. We can build beautiful hospitals, which I think Apollo loves to do, and we do. And we will always invest in the best technology, whichever is future. You know, even when I was looking at the Da Vinci Xi or the SSI robot, I said, what is next? You know, our next installation will be, which is going to be the best for the next 10 years. You know, so that's how we look at it. We look at AI and say, how can it make a difference in the way we do things and in the way we perform? And we look at our staff and say, listen, you know, what you give our patients in terms of TLC, in terms of kindness, in terms of efficiency, in terms of surgical outcome, it's never enough for us. And, you know, they all know it, that if we do well, we have to keep doing better. But you may ask me, why do we do it? You know, why does Apollo want to constantly do things and do it better? Because, you know, it's fine, it's a good organization. It's only because we do it for the patient. You know, the patient is the center of everything which we do. You know, if all these doctors have studied, worked, trained, who stand for hours in the theatre, it's only because they want to give better outcomes for the patients. If all the teams, you know, if Ilan came and said, please communicate and please let people know that the robotic is a better option because there's less blood loss, you go home fast, less rates of infection, better outcomes, and deeper and sharper outcomes because, you know, they know how to navigate it, you know, much better than we can do it with our eyes and hands. They sit behind a council, which you'll see, and they do it. So all this is because we really are committed to doing what we can for the patients. And of course, you know, Apollo is our heart, Apollo is our head, and I have to congratulate the team, I have to thank them, because in Tamil Nadu, where we started, it's Number Tamil Nadu, we have been able to do more than 8,000 robotic surgeries. Nobody has done that. So thank you and congratulations. And Tamil Nadu has supported Apollo, Apollo's mission, Apollo's growth, what it does. But more than anything else, why we have done more than 8,000 in Tamil Nadu, and we have this fabulous group of clinicians sitting with us, all India, from the time we started, we have done over 25,000. And that is the largest series in the country and maybe even in Southeast Asia, this part of the world. And that is because all of them have worked so hard, they've done us proud, and that's really what the Apollo story is. But what has happened is, you know, we were the first ones who even dared to dream and set up a robotic program. And, you know, Dr. Meera, I saw her here, she was probably one of the first, Dr. Raghvan, they all were one of the first initial team. But from doing, you know, the whole robotic surgeries this way, Dr. Hegde and the ortho team came back and said, listen, there's a spine robot and that's going to make a huge difference. So then we've invested in that. We continue to do spine. The orthopedic team, who I can see Dr. Shankar, I can see Dr. Madan. The lights are on, so I can, you know, whoever I see I'm mentioning, that doesn't mean I'm missing the others. But having said that, I think it's because the clinicians come back and say, listen, you know, this is the latest, this is the best, this is going to make a difference for us. And that's how, you know, these things happen with us. I can only say that, you know, for us as a country, we need to see, you know, we invested in the proton, it was the first, and then one more has come in India, 3 more are coming in India, out of which 2 are with us. But why do we have to invest in this kind of tech? It's only because it's making a difference for the patients, and nothing else matters. It's the patients and it's their outcomes, and that's why Apollo is here to do that. So having said that, ours is the most comprehensive orthopedic program. You know, we can have 1, 2, 3 of the same machines. And we can do that in the cardiac. I'm so sorry about the cardiac people, both of you are sitting here. Dr. Yusuf has done some phenomenal numbers in the cardiac space. So, you know, the heart has done extremely. Hans here, who's again young and, you know, going to do some wonders with us. So I'm just saying that each one of them have done amazingly well. So the cardiac program, ours is probably, you know, Dr. Satyaki in Bangalore, together, they have done the largest of the cardiac work. The Euro and the GI again has now, you know, it's like a proven standard of care that unless you cannot do a robotic option, which is rare, that you go and do conventional, it's actually now it's become the other way. That conventional can do a certain thing, but the people who are experts on the robotic can actually do it 10 notches, 20 notches better. And that is why it is recommended, because, you know, it gives great outcomes. And the same is for, you know, whether it's ortho or spine or any of these other areas. And almost every system, every frontier has been surpassed with the robotic interventions by all of them who are sitting here. But what is exciting and what is the future, and we have not taken our eyes off the ball, is trying to see how can we use it for brain surgeries, how can we use it for neurosurgeries. I don't have an answer yet, but that does not mean that we're not looking at those aspects. What is going to be exciting, good and futuristic for us, that all the work of everyone who is here will then help people with making better equipment, using it better for AI, because their data and the research volumes which they have all generated as groups has again been phenomenal.